So thank you for being here. For those of you that don't know me, my name is Angela Inzarello. I've been a member of the Chamber since 2009, my husband and I, and we've been running and supporting the business education programming here for the Chamber. We are in our 11th year of bringing these fabulous programs together. Although with COVID, we've gone virtual. So we've been doing these things almost 2 years virtually. So we've got, speaking of COVID, we've got a great presenter today. So before we get to Dr. Shivitz, I want to talk a little bit about business education and the Chamber. So if you guys you're not familiar, Inkspire is a 501c3 education foundation, which is part of the Reston Chamber. And that's where business education sits. So we changed this year to one program per month on the second or fourth Wednesday of the month from 8:30 to 9, and it's all virtual. And we try to continue to keep a networking component after. So for those that want to stay on and speak with the speaker, we had that opportunity. What we've also done is we've incorporated an Ask the Expert segment in the third month of the quarter. So our theme for Q1 is health and wellness. And that's why we have topics. We had the Alzheimer's presentation last month, which was great. If you did not see that or weren't able to attend, please let us know. We'll send you the recording because it was really, really good to kick off how important health and fitness and how you eat and exercise contributes to your brain health. So that was very good. And today we're going to be talking all things COVID. And next month is our health and wellness panel. So I will stop sharing. And I will ask for folks to, if you do have any questions, you're more than welcome to put into the chat. Our guess is that the doctor will have covered them all by the time we get to the end. But if not, if you've got something burning, we absolutely will address it. All right. So without any further ado, Dr. Shivitz, please welcome. And I said I wouldn't do an intro, but you would do the proper introduction.
All good. I'm low key, and thank you, Angela. I would like hearing about all you have going on. By the way, I'm a father of a first responder, so I think that's fabulous what you do. And you commented, and I'll make comments at the end about behavioral health. Thank you all for allowing me to come and speak to you all today. What qualifies me as a speaker on COVID? There probably hasn't been a day in the last 2 years that I haven't addressed probably 10 or 20 questions, and it's been a long ride for everybody, I know. And Angela touched on behavioral health and mental health, and again I'll mention that. And there's lots of aspects to COVID, and so I'm just going to make a few remarks, and then I'm going to roll through a bunch of questions that have been submitted by your members, and we'll make it a discussion. I'm not going to throw up any slides or overwhelm you with PowerPoints that you can't see. But today is a wonderful day. And when I say wonderful day, I want to be very clear in every one of my comments. There's nothing that I'm going to say that today we have COVID and tomorrow it's gone and we're back to normal. When I have given easily 20 talks to multiple groups, to corporations, at the start, helping some create guidelines for safety, how to deal with different aspects. And we actually have gone through multiple crises within COVID, not only the fear of infection and death, but then as well, the fear of will there be a hospital bed? Then there was the fear of the test. Can I get a test? And it was pretty bad sometimes, getting out to 11 days. And then there was the battle and the fear for vaccine. And while in both of these cases, things improved over a couple months, people were anxious those days. And then testing fears came back again. And then it was, what about oral medications? And then, of course, and I'm not going to get in with folks, the battle of the politics and people's views, but the battle of masks. And I'll just say, really, there's a science of masks. I will make one comment on masking here to say that in the initial phases of COVID, when we shut down, and it's not just masking, it's really social distancing, it's great hygiene. In the initial phases, I see patients, I went easily about 15 to 19 months not seeing a single respiratory infection. And so take COVID out of this for a second. Imagine if we all did wear a mask during flu season. And if we all did keep the hand sanitizer around and were more conscious about touching our faces, how much less illness we could have. And to keep this in context, about 60,000 people, previous to COVID, about 60,000 individuals die each year of influenza. And it's usually the very, very young, but more the very, very old and the immunocompromised. And so COVID's no different. It's just more pronounced and more visible. So thank you once again for allowing me to speak to you all. I'm going to just give you some good news here and to say that the Omicron wave is subsiding. It's subsiding due to vaccination. It's subsiding due to previous infection in the current wave of Omicron. And it's estimated about 75% of the US is immune to Omicron. And you know, which numbers herd immunity? You've heard different numbers. People have said 70%. And then Dr. Fauci came out, it's probably more like north of 80%. And I agree with that. The difficulty with herd immunity, and by the way, I think we are very close. The difficulty with herd immunity is everything's a timing game. And what I mean by timing game is that as people got vaccinated, some people waned, some people didn't get boosted. The benefit of why Omicron was so helpful to us is it spread so quickly with a shorter incubation period, and it was more mild for the general population, for the vaccinated population. So to get herd immunity, if the infection were to spread slowly over time, I could have 30 million people who got infected, who start to recover, and they're once again capable of being infected 90 days, 120, 150 days later. And so it's this cycle. And yes, as you probably know, is you can get, COVID again. Here's what and by the way, the data that I share, there's something called the Institute of Health Metrics and Evaluation. They're really the health nerds. So they're the people that are much, much smarter than us, than me at least, that look at all the databases. It's not coming from the national news. It's not coming from hearsay. They're collecting all the data that the states are submitting, that the federal government CDC has. And what we're seeing is that numbers are really going down substantially. And I would say, and it's shared, by April, we're going to see very, very low numbers, and it's probably going to continue to improve through into June. And this summer may be as near to normal as we're going to see. And I do think people are going to resume their activities. I do think that, or I can tell you that as we head toward the fall, it's expected or that Omicron may return, and that may not be the worst thing in the world that compared, and I'll mention a little bit about variants in a little bit, but Omicron will probably return. The difference being if we have this lull and decrease in time, we can mass produce, and it's been going on, more tests, more oral medications, vaccines as well, and I'll address whether the vaccine will change or not. But there has been a lot of questions about, when for the next booster for those that have been vaccinated. And initially, I was even thinking, wow, we're probably going to be seeing a booster soon, because we know that with the vaccine, actually with infection, immunity starts to wane after about 90 days. With vaccine, 5 to 6 months. So I know one of the questions I'll even cover now is when people say, is it better to be infected or better to be vaccinated? It's actually probably better to be vaccinated. Because there's also sequela and risks that that you may not realize may come your way. But that fourth booster, or some of us call it the next vaccine, is probably not going to be till the fall. It could be the fall or winter. And yes, we as providers are all hoping that it will be combined with the influenza vaccine, so that it'll be one vaccine. The other thing is people ask, will the COVID vaccine cover all COVID? Just look at influenza. Influenza mutates every year. And so we're unlikely going to see a vaccine like with tetanus or some of the bacterial infections where you get it and you're pretty much protected pretty well against that bacteria. In viruses, they mutate, and we are looking at least probably annual vaccinations. As technology changes, could it be that it's every year, every other year, or longer? Yes, but time will tell, and the pharmaceutical companies are clearly working on this. And so Let me give you, and by the way, actually, let me make one other comment, because I mentioned I was going to talk about behavioral health, but I do want to comment here that as we emerge right now, as even this morning, I woke up and DC lifted its mask and vaccine mandates, there's still going to be a lot of fear. I'll be honest with you, I have it too at times. And so, but if we use common sense and not our emotions, things will be fine. You know, last night my son had his last varsity basketball game, and you know, everybody had a mask on. There was still hand sanitizer coming in, and people still tried to space. You know, were people dropping their masks at times? Yeah, and many of us that were good rule followers get really angry when we see that kind of thing. I'm just going to tell everybody to take a deep breath. Common sense says that if you're going to be within 6 feet of other individuals for longer than 15 minutes, that was where we identified risk. And when during the height of COVID, we talked about good aeration and filters and airflow. In this case right now, I think where we're moving, and this is the opinion of Craig Chaffetz, is that if you're sick, put a mask on. And if you're actually not feeling well and there was a question and thinking you could have COVID, then yeah, maybe stick to Zooms for 5 days and make sure the symptoms go away. The good thing about Omicron is it comes fast and it goes fast and it's pretty mild. And so it's my hope that, you know, anytime somebody becomes ill, that they either avoid individuals or that they put that mask on. We have done it in healthcare for years. If I had a cold, but I felt well enough to work and I'm seeing my patients, I grabbed a surgical mask. And people were appreciative. Yeah, it sends a signal. It says that person might be infected. But now it's just, you know, if somebody says, oh, they're still paranoid or worried about COVID, okay, that's fine. But the good news is I think that we are going to be able to relax what we're doing. By the way, some of you are going to go to events where we've relaxed and somebody has COVID and you're still going to get it. Once again, the good news is if you're vaccinated, you're boosted, it's going to be more mild. And if you have a healthy immune system, you'll do okay. So some numbers just to share with you all. And again, my numbers aren't going to match. I usually watch David Muir, the 30 minutes of news that I watch aren't going to match some of his numbers, but I'll give them to you. And by the way, going back to behavioral health again, those who have heard me talk before, I'm very big on managing your media in terms of getting too much and getting misinformation. Facebook is not the best source of information, or your friend or neighbor who spouts, you know, things that, you know, aren't necessarily fact. And so do stick to the things that the better sources. But the estimated daily infections, and I'm going last week, were about 1.3 million. Sorry, the week before, last week dropped to 894,000. So went from about 1.3 million to about 890,000. My data that I'm sharing is about 1 week old. Okay. And so when you talk about just data that's out there, daily hospital census, let me just make a comment before I talk about what I have from Best Reported nationally. I work for the Inova Health System. Could not be more impressed. And you all should feel very confident that Inova is in your backyard, and our leadership and Dr. Jones. When COVID hit, we spent $34 million just to work on protecting our patients and our teams. And when we even ran into PPE issues, et cetera, what we did to keep our team members safe was incredible. What the community did to help support our frontline caregivers was incredible. But that's just a segue. But our numbers about 4-6 weeks ago were about 430 patients across our 5 hospitals. Yesterday, we're in the 60s. So this has dropped precipitously. In the previous phases with Delta, things dropped over months. Things dropping over weeks just speaks to the quality of how Omicron behaves. So daily hospital census went from 117,000 to 89,000. That's still a lot of people. I also want to make everybody aware that the cases over a course of a week dropped from 273,000 reported to 166,000. And the trends are showing that that curve is continuously to go down. But and by the way, that's still about 4 Washington National stadiums filled up. That's still a lot of people. And if you're in a more densely populated area, obviously, potentially more cases. The one thing that's still, yes, this could be seen as a good thing, but this one just shows how numb we've all become. Reported deaths dropped from 2,400 a week to 2,100. That's still 2,100 people dying in a week. And that's unfortunate, because not to say that every one of them would be prevented, but with proper vaccination, what we still see in the hospital right now are either the severely immunocompromised who didn't mount an immune response, or those that avoided the therapies we've had, and those lives have been lost. And yes, I've been impacted, not just as a provider. I'm happy to say most of my patients were vaccinated, but I know lots of people who have lost loved ones because those individuals chose not to get vaccinated.
Dr. Excuse me, did you say these are national numbers? I apologize.
The numbers, the large numbers, are national numbers, yes.
Okay.
So the 2,400 down to 2,100 deaths are national numbers. You can go drill down. I think many of you have seen it, whether it's Johns Hopkins or the Virginia Department of Health. If you're in Maryland, you can do the same and see what the numbers have been reported in the local community. But the most important number to watch for us has been hospitalizations. And hospitalizations have been dropping precipitously. So I'm going to roll into, there's probably I think I answered some already, but I'm going to roll into about 10 or 15 questions here that have been shared with me, and then we'll open it up for discussion. Question number 1 that had been given to me is, what, and very appropriate for your group, is what are the risks with contracting COVID once back in the workplace? And so those stick to what my comments were before, which is, 6 feet, 15 minutes. Is somebody coming into your store, likely in an open air space, that you're working with or communicating with for a few minutes, going to transmit COVID? Probably not. But what I'm going to say to you is it's going to speak to another question I think that was here, which is it really depends on their viral load. It depends on really how close you have been. Have you lost track of time? You have somebody who right at the point of just before they declare symptoms or the peak of their symptoms may have a higher viral load. One of the questions I get asked often, I got asked by a human resources executive at Hilton this question recently, which is if you have a vaccinated person and an unvaccinated person, are you at more risk getting, and they both have COVID, who's more at risk for spreading? And there are some studies out there. Israel's done a good job, but there's a handful of studies that show that an unvaccinated individual does have a higher viral load. Now, I would tell you as a clinician, I don't have the study. The next step, though, is obvious. A higher viral load does result in a higher transmission. And so now a higher viral load with a higher transmission, but you have a MERS 13 and the doors are open, you still may not get it. And somebody's immune system may be different. So there's still variables at play, but the more unvaccinated infected individuals, the higher the likelihood that you're going to see transmissibility. What are the long-term effects of COVID? This one has been an interesting discussion, and why it's been an interesting discussion is because of the debate on vaccination. There is virtually no long-term consequence to a vaccine. We haven't in history. It really has not been seen. Yes, there are examples who may have had a reaction related to them, but we do see long-term consequences of infections. Prior to COVID, we have known that Epstein-Barr virus can cause or result in a chronic fatigue syndrome, which is very real in many individuals. And we are seeing over the last 2 years individuals with COVID who have chronic arthritic complaints. I have a patient who pre to COVID had no issues with her hand, and she's got a pretty significant arthritis. There are issues in energy. There's been mention about brain fog. My wife likes to quote this, and it has been really effective for over the last 2 years. And when people ask me a lot of these questions, I said, we'll absolutely have the best evidence and know, and probably in 3 to 5 years. Right now, when we do studies, we used to have studies that would run for years or even decades. We're now looking at studies that are tiny. We're looking at anecdotal information. We're looking at by hours and weeks and months as the standard. So just so everybody to be aware. But yes, I do suspect there are going to be long-term consequences of COVID. Will there be consequences of people that have been infected and recovered perfectly well? Time will tell, but probably not. If you look at the history of infections, it's typically not the case. I think I covered on what's the latest data on the spread of COVID. By the way, you can still have a situation, whether it's a college campus or you can do an icebreaker somewhere or get together and somebody's highly infected and gives it to 10 people. But it will remain mild, and the more they're outside and we get toward the better weather, hopefully the spread wouldn't be as much and people would recover faster. In terms of, somebody had asked about what's the latest recommendation for quarantine, it hasn't changed, which is the latest CDC is you're quarantined if you're infected for 5 days. On the 6th day, because people will wonder, is it the 5th day or is it the 6th day? On the 6th day, if you have no symptoms, you're still supposed to go out and about and wear a mask. Even if mask mandates are lifted, that doesn't change right now. CDC has not changed that. And so if you have been exposed, known exposure within 6 feet, and you did not have a mask on, and especially if you have not been vaccinated, then that's quarantine. The difference between isolation and quarantine is you've been exposed. Isolation has been you have the infection. And so that's just being smart and being respectful and a good citizen to those that you love and those that you work with. There was a question about best masking, and I think we started talking about doing this talk about 3 or 4 weeks ago. And this is what's interesting, folks. And please, I pray and I hope what I'm about to say stays, because I gave a talk to the Washington executive group, about 100 individuals in right around Thanksgiving or so. And a few days later, Omicron hit. And it wasn't that anything I said that was wrong. I actually did say it, and you'll hear Dr. Fauci and others say it. This all holds if another variant doesn't hit. And if that variant that hits isn't resistant to our therapies. So now everybody's wondering about BA2 and the BA2 variant. It is more infectious than Omicron, but the vaccines and medications still seem to have some benefit. And the fact, if you remember earlier when I started, about 75% of the population is probably protected. So we're not seeing a rapid spread, but we should be watching for it. And that's one of the things that you and I don't do, but our health departments and the government, surveillance is going to be extremely important. So testing, when you, not necessarily your home test, but if you go get your PCR or you get swabbed somewhere, those samples find their ways for testing purposes for variants. And if the variant is resistant to some of the things we have, then we have an issue. But right now, I've seen a few different numbers. The BA2 variant, last number I think I saw was about 4% of isolates, those that are isolated. I think I saw 7. So it's not huge right now. But as we saw with Omicron, it could change. I don't suspect that it will, because the timing of the seasonality that we're coming into warmer weather, with the number of people vaccinated, with the number of people that are infected. But this could change the game, or I don't know what to call the next one, BA3 or something else. If that happens, then we could be sadly back where we were. So, and again, on the mask piece, by the way, N95 better than surgical better than cloth. Gaiters, don't wear them. And I'll say to you that an N95 properly worn, and some of you have seen it, could protect you from getting COVID if you're sitting with somebody with COVID for up to 25 hours. I know it's hard to breathe with them, but they are. Surgical masks showed protection of about an hour. Right now in our offices, we have all the capabilities. So if I'm just seeing a general patient for a physical, I've had a surgical mask on. If I have somebody coming in with infection that I'm unknown, I'm putting on an N95. If I'm suspecting COVID, and as I said, Inova invested in its healthcare providers. I put on one of our P100 masks, which are respirators. And Steph Herbert, who's here, her team led this. Inova purchased at one point, and Steph, forgive me if I mess up the numbers, 11,000 permanent respirator masks for team members out of the gate, and we to avoid the battle for PPE, and her team has been keeping our team members safe. Going back to the questions here, do antibodies protect as well as the vaccine? In the first 90 days, probably, but as I said, there seems to be more variability in the waning. And so a vaccine would be the preference. And then again, people were discussing having those infection parties early on. There's just too many side effects. There has been shown increased hypercoagulability where people get PEs and clots. Usually these individuals are more ill with COVID, but the number of sequelae that you can get from COVID, you much rather vaccine over the infection, even though I know that Omicron has been, for the majority of people, more mild. Somebody asked, when are people with coronavirus more contagious? So we think probably it could be the second, really the timing, the hours before, the day before somebody is truly symptomatic, but when they're symptomatic is the actual answer. BA2, I commented on. Will there be a COVID-19 vaccine that covers all coronavirus variants? No, because it mutates. What's never going to happen, it's going to be more like the flu vaccine that we're going to see. And again, hopefully, COVID. I think Pfizer's already working on it, or maybe another company. There are financial benefits, obviously, for these companies to work on these things, so they are looking to see how they can combine these. Pandemic versus epidemic. Here's the thing that I started out with: it's not going away. It's going to become controllable, and we are going to be going from the pandemic actually to not even epidemic. Really should be endemic. COVID's going to be around. There's going to be times where you're going to travel, and you're going to have countries that have hotspots or areas that have hotspots. If you ever travel internationally and you check the CDC website, we do it all the time with our patients. If you go to Africa, what should you have in terms of prophylaxis? And so there's hopefully will be continued surveillance for you to know that not necessarily not to go maybe, but to mask up and what your risks are in certain parts of the world. And the United States, because we are a wealthy country, is going to be ahead of many other countries. And yes, because it is in our best interest to get the world vaccinated, because the slower we vaccinate and treat the world, the more variants that come around, and the more variants that come around. This is a porous globe, and we are absolutely going to see variants the longer it takes to get control here. Some things related to your workplaces. How do we lower the uncertainties of employees returning to work safely? I think you share the data. I think you still allow people who want to mask up if mandates are lifted to mask up. I think you still enforce hygiene. I think you still remain positive on protective choices. I think you're very firm. If you're sick, stay home. If you're sick, mask up. It's the right thing to do, and you appreciate people for it. How will you reduce apprehension of people coming into your stores? People are thirsty. They're coming. The ones that are apprehensive will wear the mask already. You can provide all of the measures that existed previously. Some won't comply because they won't be forced to comply anymore. Don't lose stress over it. You may have to reinstate these as things change in the fall. You may want to reannounce that, healthy hygiene is important to us regardless of COVID. And so we do these things to help protect you. And so having a positive statement and a positive approach is important. And then somebody had asked, can you provide good examples of establishments getting past these unknowns surrounding COVID? You all already know what to do. And as I just mentioned, there's variables in terms of how people comply. My closing comments here is in all this, we keep saying COVID. We mentioned it before. You're all familiar with it because you may have kids, you may have family members. Don't ignore the behavioral health crisis. focus on wellness of your individuals. I sent to our chief people officer, Carrie Feely, who's phenomenal. I said to her, I sent her an email this week saying, I'm so impressed with our culture because I have 9 individuals from divorces to people who have kids who unfortunately have been suicidal, all aspects, take away work stress that are here. And there are not enough sometimes mental health providers. And there's a lot we can do to check in with folks. There's a lot we can do to give people breaks. There's a lot. We do senior leadership rounding. I did it yesterday. And we rounded on one of our financial teams. And the financial team kept talking about how they were doing in their work and what was going on. And I stopped the individual. I said, how are you doing? And this individual kept going on their work. And I stopped him again. I said, no, you may not be used to this question. I said, how are you doing? Because yes, we're in ANOVA's in the business of taking care of our patients, and we will always say our patients are a priority. But I personally always say I put our providers and our care team right next to our patients, because an unhealthy provider or an individual who's not focused doesn't provide the perfect experience. And so our team members are so important to us to provide the best care we can for our patients. And so the last comments I'll muted there. As we go back to our normal, think about what we shouldn't go back to. Think about what we should keep. Sometimes we should be Zooming. Also, be aware there's something called cognitive deconditioning. People will forget what it was like before COVID. And so you're going to have to give people some time. It may take a few weeks. I said to my teams, we need to remember, I'm also the dean of our regional medical campus. I said, we need to remember what our activities were before COVID, because I honestly am struggling to remember some of this. And how do we do it? It's kind of like walking again or speaking again. And so what are the super cool things we should keep? And what are the things we have to dust off and remember? And so with that, let me just say, I want to say thank you in case I do not say it at the end. And I don't know, Angela, if you want me to read through some questions or if you want to.
Yeah, there's a couple of questions that came towards the end. I can kind of filter through. I know you've been talking. So a couple of them are related to travel, of course, but the first one was personal results from antibody tests to determine if a booster is necessary.
Yeah, so that's a great question. That does come up. Let me first tell you, for current recommendations are not to do that. Here's what's interesting is if you have antibodies and your antibody test measures it that it's positive antibodies, but it's low, is that enough antibody to treat the infection? And so we really don't know on the curve. If somebody is, let's say they got Pfizer and it's month 5 and their test comes back, positive. What happens a few days later, potentially? The other thing to be aware of is while we talk about antibody, your immune system's really smart. There's actually something called Tcell immunity. And so even if your antibodies are negative, it doesn't mean if you've had COVID or if you've been vaccinated that you don't have some additional immunity that either prevents you from infection or helps you get over it.
And then the other one was related more to travel. What is the recommendations people who want to travel abroad and protect themselves against COVID?
So again, if you can figure out data where you're going, that's great. Carry your kit is what I'll tell you. Have a few surgical masks, have an N95 mask. Make sure your hand sanitizer meets the FAA rules for safety. Going through, don't carry that gallon jug of hand sanitizer. But I think you do smart things. I think you're going to see a lot of people that just mask up while you're on a plane, even though planes have really good circulation in terms of airflow. Although if you're next to somebody who's infected, it may be beneficial there. But when you're traveling, just know where you're going. And you do the same things that you would do here. The difference being that some countries may not have measures to measure exactly what's going on. And yeah, if you're going to the Caribbean, go to the outdoor cafe and hit the beach. Don't go to the indoor restaurant. There are some things you can do also to help mitigate some of your risks. I always like take the stairs and avoid the elevator if you can, but you're still in the elevator. You're only in it for a few seconds or less than a minute. So even there, you're probably safe.
And it's better to take the stairs, they say, right? So
it helps your blood pressure. Keeps you out of my office.
It's exactly what we want. Well, there's no standard, right? So you've got some airlines that are saying you've got to wear a mask even when you're eating, and and then others that don't. So you can only provide a standard that you can follow.
Exactly. And I honestly, I think the good news is as COVID is reducing, I would stress and get frustrated with people that were non-compliant. You watch the NFL coaches wearing masks under their chin and saying, "What are you showing these kids?" And it would get very, very frustrating. Now at this point, I am a healthcare provider. I want everybody to be healthy. I want everybody to live, but people make their own decisions. And so the good news is with Omicron decreasing, those that are all been fully compliant are a little bit safer, even with an infected person, because you're vaccinated, or you're outside, or you're wearing a mask, or honestly, there's just less infected people around us now because numbers are decreasing so much.
What are your opinions about oral antiviral treatments? Do you see new treatments in the future?
Oh, absolutely. First of all, I will tell you that once again, the news reported these oral antivirals for COVID, and everybody's like, "Oh my God, it's not a replacement for vaccination." It also is, in both cases, for the Merck drug and the Pfizer drug, about 40 pills over 5 days, 8 pills a day for 5 days. The one thing I will also tell you is, everybody can't get it, and there are a lot of drug interactions. When we have to prescribe the Pfizer medication, we need to look, and in some cases, we actually can't give it to them because stopping their current medication isn't enough. In some cases, they're ruled out. In other cases, we have to stop other medications in order to give it to them. It takes us right now probably about, depending on how well a physician knows a patient, 10 to 20 minutes to go through a medical record and then finding it. The good news is with the decreasing cases, there's going to be an increase in the number. But the answer is, I hope there's better and better, just like we saw with HIV over the years, there'll be better and better therapies. Hopefully there'll be a one pill, like Tamiflu existed with influenza. So I can't not see it improving and getting better. But we have what we have right now.
One question that we talked about, it wasn't submitted, but vaccines for those under 5 and the delays. Do you have a comment on that?
You got to respect the CDC and the FDA and those running the trials. That by the way, it wasn't so much, at least my knowledge, that there was a danger. It was actually not an insufficient response, meaning the dosing wasn't sufficient. And so why would we stick all of these kids if we weren't going to get the response that we need to protect them? Right now, we'll see if it happens. I think eventually there will be a vaccine in those kids, but it may not be till the fall. And that was one of the reasons I always said everybody should get vaccinated, mask up, and do the right thing, because there's vulnerable populations, and I personally think it's our responsibility to help protect those innocent kids for the most part. And spreading it to a parent who has a young kid is just not fair either.
No, agreed. I mean, we were following. Do we take guidance from what was happening throughout the world?
Well, wait, I understand. Are you saying, do we take guidance from the world? Absolutely. Israel has been ahead of a lot of folks in terms of a lot of their research. And so I think the world comes together, the World Health Organization. Now, does everybody listen to each other? Are there different opinions? Yes, because what I said, the science is so small, the studies are small. Pre-COVID, we would never have taken any of this data, but it's the best we have. We shouldn't fault anybody. We shouldn't become angry with anybody. We're going with the best that we have available at the time to make the best informed decision based on the best expertise that we have. Pre-COVID, we would have been 5 to 10 years and studies to tens of thousands and hundreds of thousands of people. We needed to make a decision to help save lives. It's the question of do no harm, which is, what's the risk benefit? Is it safer to proceed, or is it safer not to proceed?
Are you seeing corporations, and now this is open for discussion. I think we've answered the questions that were submitted. So if anyone wants to add or raise their hand, feel free. This is more of a discussion. So as a business organization, we kind of go back and forth what we should deem out to our members and to the community. And do we require these mandates? Initially, it was great for the community. Now we're not second guessing, but we're rethinking that policy. So should we open it up? So are you seeing more of it, because you talk a lot to organizations? Are you seeing people being more lenient or taking a stronger stand in protecting their?
So we see everything. Prior to the last couple of weeks, most were taking a stand. Most were, and by the way, taking a stand also could be somebody who's immunocompromised, having the ability to work from home. There's various variations in, you look at, this is different, but the handicap rules, there's different provisions for different team members. But in general, I was seeing, especially in our area, more and more individuals, either mandating or testing. The one thing I just want to, I can't believe I didn't cover it. I covered in just about every talk, and the fact that things are probably getting much better, because I didn't make my comment on testing. One of the things everybody needs to know is, yes, a test is better than no test. But the antigen tests that were put out, if you read all of them, were originally intended for symptomatic individuals. We don't, at Inova, we don't test individuals with an antigen test unless they're symptomatic. But antigen tests were used for screening. And so if you get a positive antigen test on a screening, then probably the person's pretty close or is absolutely infected, but for the small number of false positives. But you doing an antigen test on millions and hundreds of millions of people, you're going to miss at least 40% of those. And so, but to speak to it once again, it was the best we had to do for a population. So I wouldn't have not done them, but people need to recognize that, where we always touted where possible, do a PCR. And the companies that were doing PCR once a week on Thursday for the following week, for those that were not vaccinated, made sense. I think you're going to see a lot of these go away in the spring and the summer as things improve. And then I think people are going to bring back the hygiene and the distancing potentially for the fall. We should never let up on encouraging vaccination and encouraging boosters, because that is going to help keep us from getting into pandemics and epidemics as much as possible.
And did you see a change with people or a difference, whether if you were originally vaccinated, first and second dose and a booster, and mixing up the vaccines? Was there?
So I can't say I personally saw a difference. I will tell you that I did read some studies that came out that showed individuals that originally got J&J who got Moderna had a 76% increase. So I had a handful of patients who got the J&J vaccine. So I said, I want you to get the Moderna booster. In the case of Moderna versus Pfizer and flip-flopping, I didn't notice anything or read anything. There's are differences. You got to remember, when Moderna's booster is half the dose of its regular dose. Pfizer was the same. So they are looking at, from a standard of antibody response, how do you equilibrate and get the best response, typically above 90. By the way, I just want to alert everybody, the previous influenza vaccines, at best, and again, they didn't kill as many people, but at best usually were 60% effective every year. And now the media and everybody looks at COVID and says, we want it to be 90% effective. Even the J&J that came out at 72% effective against hospitalization and death, pretty effective. And so remember that vaccines, again, even the flu vaccine, don't guarantee not getting the disease. It helps prevent you from dying or being hospitalized. By the way, there was a question in the chat. Somebody mentioned about the home testing. Yeah, the numbers have always been higher than reported because the home tests aren't getting reported. But they'd also would skew the data because of false negatives. But yes, the data is as good as we can get it from some of the national tracking. Somebody has, for large indoor events and concerts, we're still requiring audience members to be masked and encouraging them to sit 6 feet apart from others not in their household. Are there any other safety precautions we should put in place, or other than asking for proof of vaccination? I think you have it. The only other thing isn't necessarily that the people in the room is are you in a place that has really good aeration? Can you leave the doors open? What is the ventilation system look like? In 2 years, there isn't much more. You're not going to put an N95 mask on everybody, especially if things are getting better. I think you're doing the right things.
Are there any other burning questions or discussion items? I think we covered a lot. This has been a really informative, eye-opening. A lot of things we knew. We didn't want to get political, so this is all a really, really good discussion. So thank you.
Very helpful. Thank you. Yeah.
I mean, most of the folks on, and we explained who would be here. This is so important personally, but also for our work and who we deal with every day. So it's really, and we're all about information and what we need to be doing. Because you're right, listening to Facebook. So the best resources, I mean, the CDC website is probably number one, right?
CDC is excellent. If you go to the Virginia Department of Health, they have lots of great numbers. Maryland has it, and DC has it too. They have their tracking and their information are excellent. The government reporting is, I think, as accurate as we're going to get. By the way, I do this intentionally. My email is right there next to my picture if anybody has a question. And I see Steph did it too. Steph's got her email there too.
Yeah, thank you guys for being resources and active in the chamber. And this was really helped to be put on by our Health and Wellness Council. Thank you for your support. But yeah, this is great.
We're here, and I see my friend Dominic also touting the Innova background. I actually, believe it or not, had a green screen for almost 2 years. I took it down a few days ago, and I said, heck, my team needs to know when I'm at home. I'm blurred up because you'll see pictures of me on family on like doing things like triathlons and other fitness stuff, and I was like, I blurted out. But no, we all got to be real. We all have to be pretty. Open to change as COVID has taught us. But I appreciate the opportunity. We are always here for everyone. If there are questions, if we can help you out with anything, please always let me know.
Yeah, it has become the new norm. We just are accepting it. Hence the reason why this programming has become virtual, probably will remain virtual. So you said you had a child who was a first responder?
I do. I have my son, Jared, is 23. He works for Fairfax City. He is a paramedic firefighter. Additionally, on his days off, he works 8 days a week, not 7. He goes back to Harrisonburg. He went to JMU, and he volunteers as a paramedic and a firefighter down there as well. So he goes nonstop. And by the way, if not to tug at people's heartstrings, for the first 6 months of COVID, it was prior to him getting hired by Fairfax City. He spent his first 6 months living at the rescue squad in Harrisonburg, Virginia. He ran over 1,000 calls. The previous record was minute to that. And my wife and I decided to go down there. And this is, again, remember, we were talking about what COVID could kill anybody. We didn't know. I have a picture. He wouldn't let us post it, and we didn't post it, of my wife wearing a 55-gallon drum liner, and she put it over herself, no holes, and hugged him for as long as she was breathing there, and then stepped away, and we went and saw him in the parking lot. And as a dad, I did everything I could to get him a P100 mask. Matter of fact, Innova heard what he was doing and gave us a mask for him while he was down there. So he's all in first responder. I'm very proud of him.
Awesome. Yeah, it seems long ago that we were that way. There were so many unknowns, so we've come a long way. We've had to. So, Dr. Shivitz, thank you. Stephanie, thank you, and then Dominic, thank you for being here from Innova. We appreciate your time and your valuable insights.
Thank you all.
Yes, thank you very much.
Thank you.
Thank you.
Thank you.
The rapid spread of the novel coronavirus led to one of the largest global economic shockwaves that we have felt in our lifetimes. For too many businesses and the individuals they employ, the impact was immediate and far more prolonged than anyone could have imagined. For households with savings, the impact could be absorbed for a while. For others, there was no safety net until our community came together, and with the support of the federal, state, local government, and community partners, we responded.
For one family who lost their housing because they just didn't know that these resources existed, it could be many, many years before they're able to get back on their feet. And so if we could help them for a couple months pay their rent as opposed to having them potentially be homeless for years, that's a good, wise investment. And so our goal with all of our federal dollars was to get them out the door as quickly as we could. And frankly, because the county has built a level of trust with the community and has so many community-based partnerships in the faith communities and the nonprofit communities, I mean, we literally had an arsenal of help to get that money out the door.
While the magnitude of this pandemic has been global, it's the individual families and their stories that matter most. Allie and her 2 adult daughters were stably employed by a local hotel in March 2020, but by April, all 3 had been laid off. With the eviction moratorium in place, the family was safe from eviction for the time being, but they were quickly stacking up big bills and rent debt while they looked for work. Unemployment insurance payments ended when the 2 adult daughters found part-time jobs, but Allie continued to struggle as a shoulder injury was keeping her from returning to regular work. Critical financial assistance from the county and our community has helped pay off the rental debt they had incurred so that they are not facing eviction today.
All people who contribute to our economy are important. And it doesn't matter what job you have or what your income is at the time of a pandemic, no matter how many resources you have, you still needed these folks on the front line. You needed a grocery store clerk to check groceries out for your family. You needed delivery truck drivers to get products to your home. And so I hope as a result of this, in terms of affordable housing, this changes the thought process a little bit, that these are real people. Not just numbers of units, not just amounts of money, but real people who work hard every day in our county and our community that are essential to our economy, that from time to time need supports, need affordable housing supports, need mental health supports, need other type of social supports that so many nonprofits in our community can provide.
Business closures have not been the sole impact to working in the pandemic. The impact on schools was severe. Maria is a single mom of 2 elementary school-aged boys. When the pandemic hit, she lost her job in retail. The elementary school closed and turned to virtual education. Maria had no support system to watch the boys during the day. She filed for unemployment, but the system was so overwhelmed it took over a year for payments to come through. Unable to work because she had no child care, Maria accrued significant debt. She has now been able to find work, and thanks to community support, contributions were made to bring down some of her debt.
There are so many strong, long partnerships we've had with community and nonprofits throughout the county, like Good Shepherd Housing. And so we knew at the beginning that we were going to need their help. And that those partnerships were built during good times, and during challenging times is really when those are tested. And we were tested, our community-based nonprofits were tested, and they delivered for our community.
With the support of our community in Fairfax County, Good Shepherd Housing has distributed over $2.8 million in financial assistance, helping hundreds of families like Allie's and Maria's. Together, with your continued support, we are able to help families who may be struggling keep a place they call home.
Estaba bien mal. Y así fue como todo se fue dando bien rápido, porque ella estaba bien mal de salud, tenía fiebre, congestión, no podía respirar. Ella tenía una distrofia en los adenoides y las amígdalas. El doctor decía siempre que la llevaba a cualquier urgente que era la emergencia, que necesitaba operación, pero que necesitaba tener los recursos económicos para poder hacérsela. Aquí en este país la salud es bien cara y no todos tenemos acceso. La llevé a varios doctores y todos me sugirieron que necesitaba la operación. Fue una feria de salud que hubo en LongTerm. Ella muy gentilmente pues me informó del programa de NCCP para los niños y llevé los documentos que ella me solicitó y pues gracias a Dios fuimos aprobados rápidamente. Gracias a Dios, Kaiser Permanente y el programa de NCCP cubrieron todos los gastos médicos de la operación de mi hija. Doctores, enfermeras, nos trataron especial, un trato especial y nos brindaron toda la ayuda necesaria. El CCP ha ayudado a mis hijos varones con sus examen físico, vacunas, se las pusieron al día y pues el cuidado de sus ojos, que fue recomendado por la escuela y pues NCCP ayudó con eso. La verdad que no hay palabras para describir lo que siento, lo agradecida que me siento. Devolverle la salud a un hijo es bien importante. Sentir la cobertura, sentirse apoyado, no uno solo. Cuando yo conocí el programa de NCCP, la vida de mi familia cambió la vida de mi hija. Hace 2 años, el 4 de julio, ella estaba y pues ella miraba la piscina con sentimiento y no podía disfrutar. Y este año pues estamos ansiosos esperando el verano porque va a poder disfrutar como una niña, como un niño normal con salud. Cuando uno siente que todo está perdido y que nadie puede ayudarle, se entera y se da cuenta pues que hay gente buena, gente altruista, gente que tiene los recursos y que está ahí para ayudarle. Gracias Kaiser Permanente, gracias NCCP por ayudarnos y pensar en personas como nosotros. Gracias.